The main purpose of primary care is to improve the health of the public by providing easy access to medical care. It also focuses on the whole individual rather than on the illness of a specific organ, system, or disease. It aims to improve their entire health and well being by preventing or solving any health problems that may be present or potentially present. So, here we will be learning the functions of the department, the team players in this department, how time can be managed well while training in this department, the roles and responsibilities of a house officer in the Department of Primary Care, the expectations of being a house officer here, and last but not least, the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. So, what is primary care? Primary care, also known as family medicine in Malaysia, is the first point of contact that a patient has with healthcare provision. Primary care doctors are also known as family doctors, general practitioners, or family physicians. Those with recognized postgraduate qualifications in family medicine, as listed in the National Specialist Register (NSR), are known as family medicine specialists. So, primary care practice is guided by the principles of the discipline. This comprises of care that is primary contact, personalized, patient-centered, preventive, comprehensive, continuous, coordinated, and community-based. So the unique features of primary care is the primary contact. Primary care is usually the first point of medical contact in a healthcare system. It's very person-centered because it manages a patient's conditions taking into account the individual's physical, psychological, social, and cultural factors. It is also known to be preventive because the doctors have the opportunity to work with patients to reduce the risk factors and triggers through lifestyle changes and treatments for the promotion of health and well-being. As for professional and competence, doctors must be professional and competent in their care for patients because it can be frustrating with long hours and crowded clinics. It is also a form of continuing care because it has a unique consultation process where the care is provided as and when required over long periods of time and potentially a patient's lifetime. It is also known to be coordinated because it coordinates for the patient, working with other professionals and managing the interactions with other specialties when needed. It is very community focused because working with the community on a long-term basis enables primary care physicians to identify patterns of diseases and effective treatment through the direct observation of the prevalence and incidence of illnesses in that community. Now let's get to know the team. The District Health Office looks into the operation of the health clinics. At the public clinics, the family medicine specialist heads assisted by the medical officer. The house officers are placed at the rural or urban health clinics. The team provides care for maternal, child health, and chronic cases. How about the nursing staff? So we begin with the unit matron. Matrons are in charge of the nursing service division and they are directly accountable for the proper organization, direction, coordination of the nursing services. They are the nursing representatives of their units to raise issues to the District Health Office. They will arrange and organize staffing requirements and other resources needed by their units. Then we have the clinic sister who organizes all nursing activities of a clinic in accordance with health office policy and rules. The clinic sister also assists the doctors to supervise patient care for maternal, child health, and chronic cases. She takes care of the well-being of her nursing staff team as well. She is in charge of ensuring all the records of the patient related to diagnosis, condition and treatment, and ensure proper maintenance of the records. Then we have the nurses, which are further divided into the clinic staff nurses as well as the community nurses. The clinic staff nurses are stationed at the clinics and they are in charge of recording patients' vital parameters, registering them at the counters, as well as administering the medications needed within the clinic area and assisting the doctors in charge in the clinic rooms. As for the community nurses, they are dispatched out to the communities in order to provide antenatal and postnatal care, as well as screening and preventive health promotion. Next, we have allied health professionals, which are the pharmacists. Clinic pharmacists dispense medications and also provide counseling to patients and the family members. They provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages, and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. Of late, we have the service where we can post medications to the patient's home, and this has been very convenient, especially during the pandemic. Then we have the support staff, which are further divided into the clinic assistants as well as the lab assistants. So the clinic assistants are involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and maintaining the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring menu choices are completed and communicated to the appropriate department. Then we have the lab assistants, who are medical lab technicians who assist physicians in the diagnosis and treatment of diseases by performing tests on tissues, blood, and other body fluids. Then we have the support staff, who are the imagers. The imagers, also known as the radiographers, are certified technicians who capture images of organs, bones, and tissues for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and interpersonal skills necessary for patient care at the clinics. Now, let's quickly run through a flow of work. Primary care is a specialty that interacts with patients and their families and physicians, so enjoys strong and often long-term relationships with their patients as a result of the continuity of care. So they see patients through many important events in their lives, such as premarital screening, care for chronic diseases, and the birth of their children. Here, you will be assisting the primary care physician and the medical officers in these three areas. Let's take a look at a few time management tips, because time management is extremely crucial to reap the maximum benefit of training during your housemanship. First tip, create a job list. Make a customized table to summarize your clinic work and tasks systematically. Prioritize your work that needs to be done within the office hours or the extended hours that are given to you. Cross out the task that has been carried out to avoid confusion between colleagues. Then delegate tasks among you and your colleagues, such as blood taking, probably referrals, requesting imaging, and assisting your medical officers in simple procedures. Next, take turns with your colleagues if you wish to take a break, and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. Use electronic or digital productivity tools, which most of you might already have in your daily usage devices, such as your smartphone, iPads, or a digital notepad. Utilizing the reminder, notifications, and planner apps or systems can not only save your time, but also ensures tasks are completed. So what do you expect as a house officer here? Primary care is a specialty that interacts with patients and their families. So here, communication skills are very important. They see patients through many important events in their lives. Primary care is a vocation where the physician is often regarded as the family doctor, and the patients often say that they do not want to see anyone else but their family doctor. So here, this is where you bring about the health promotion and screening methods for your patients if you see them. In primary care practice, you have the opportunity to provide preventive and promotive care at a personalized and community level, and you should be good at and empathetic communicators. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. How do you go about it? So, there are two main pathways for postgraduate training in primary care medicine in Malaysia. The university's master's program is a 4-year to 7-year maximum program in which trainees are registered to one of the 6 universities in the Conjoined Board of Family Medicine, namely University of Malaya, University Kebangsaan Malaysia, University Science Malaysia, University Putra Malaysia, University Technology Mara, and University Islam Antarabangsa. It is divided into hospital rotations and clinic postings. The second pathway is through the Academy of Family Medicine program, which is a 4-year program. It is run by the Academy of Family Physicians of Malaysia and divided into Graduate Certificate in Family Medicine, which is of 2 years duration, followed by the Advanced Training in Family Medicine, which is another further 2 years. So, family medicine postgraduate training is a 3-phase training program. All pathways cover all the elements in the curriculum's 3 phases of training. The first phase, which is the knowledge and clinical skills blocks which form the foundation of the postgraduate primary care training. This then, you can move on to phase 2, which is the clinical practice skills and are particularly relevant to primary care. These skills include consultation, prevention, counseling, multi-morbidity, clinical acumen, and holistic care. And finally, we have phase 3, where there is development as practice leaders with an emphasis on leadership and managerial skills. These include practice management, administration, audits, community involvement, interagency relations, and human resource management. Now, this is a list of the recognized postgraduate qualifications in Malaysia for family medicine. And these are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered family medicine specialist in Malaysia. You may find this list on the Malaysian National Specialist Registry website. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding the roles and responsibilities of a house officer in the Department of Primary Care, what is expected out of you while you are on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. Let's now look at some resources for training which we have gathered for you to aid and assist your learning while you undergo training as a house officer in this department. We have the NICE Guidelines, which is a key resource that keeps your practice up to date. It provides you summaries of the most common and significant presentations in primary care, clear and practical knowledge to help you put UK guideline recommendations into your practice, as well as the best evidence, national guidance, policies, and practice collated and summarized. Then we have the Academy of Family Physicians Malaysia, which is an extension arm of the Academy of Medicine Malaysia, where one is able to get further guidance on the pathway to specialize in this field, the necessary documentation required, and updates on this field of medicine in Malaysia. Then we have the all-famous Dr. Mike, which is a multifaceted, board-certified family medicine physician, media personality, educator, writer, and philanthropist. He has garnered a huge following on social media. He has excellent communication skills and guides fellow doctors who watch his channel on ways to communicate better and explain complex conditions in a simpler way to patients. Then we have Geeky Medics, which is a clinical exam site which is able to provide you a comprehensive collection of OSCE guides that include step-by-step images of key steps and video demonstrations. Last but not least, this is a quick reference guide which is compiled by the group of doctors during their stint some few years ago in primary care. Its useful and essential information are provided here for your additional reading. Well, we have finally come to the end of this session. We hope it was insightful and thank you for your time.